Hello, everyone. I hope everything is going well as you start to settle into the spring term. We're now at week number 2, and I appreciate you taking the time to do the introductions in the first week's Canvas activity. I'm enjoying reading through them, and as a reminder, please make sure to reply to at least 2 other comments by the end of this week. So for this week, we'll be getting into a new topic in just a little bit. So just as a quick reminder, if you haven't done so already, please make sure that you are securing a version of the textbook this week. You can use the VitalSource ebook that was linked in a previous Canvas announcement and purchase that online. You can also purchase a book from the EOU bookstore or ship through Amazon to get a copy delivered. If you're running into any issues with accessing the reading for this course, please let me know as soon as possible so that I can help you to complete this week's reading assignment. The week number 2 quiz and week number 2 activity are available, and we'll be asking you to complete that week 2 content in order to complete the assignment. The other thing that I wanted to put on your radar is the annotated bibliography that'll be coming up and due at the end of week number 3. So for this week, what we'll be exploring is patient-provider relations, which is a huge part of communicating health and science, and one that brings in a variety of important implications. So the annotated bibliography assignment is available for you to access on Canvas and to start thinking about. If you need some additional time on that, please let me know by Monday at the latest, a week from today. The rubric is available for you to complete on Canvas. And what I'm asking you to do is to pick a topic that's interesting to you in health and science, right? What brought you into this class? What is something that's connecting to your other courses? What are you thinking about doing after EOU? So for instance, you might be looking at COVID-19 and the context of COVID-19 on issues related to health. You might be looking at issues surrounding sports medicine. How we are able to utilize health and human performance. You might be interested in terminal illness and how communication at the end of life is being shared. Or you might have a variety of topics that are completely outside of that area that you're interested in too. There's a whole lot of flexibility here. If you check on Canvas, you'll notice that this assignment is asking you to include 5 to 7 outside scholarly sources. Those would be journal articles or book chapters that are related to your topic. I'm looking to make sure that you include full annotations for this assignment, that each annotation is about a paragraph long, that you are selecting credible sources. So things like a blog or Wikipedia are not great to use as sources. They can be good starting points, but you might use the references and links that they provide to get to your actual source. And then to look at effective conventions and organization, making sure that you are spell checking. I recommend that you use the Purdue OWL, which is a really great resource in order to find some ways of structuring and utilizing the citation style effectively. And I have an example annotation that you're able to use that's right there on Canvas. So when it comes to searching online, you can use the EOU library database. That's an excellent starting point. And we have a variety of different sources, subscriptions, and other resources that you can draw from. JSTOR.org is another great resource that we have integrated with EOU. They even have a text analyzer feature in which you can enter a paragraph or an essay, and it'll search it for the most common keywords and find articles that are similar to it in terms of content. Google Scholar is also another great starting point where you get to do a Google Scholar search. You get to see what relevant articles come up that could be a good fit for your topic too. And if you're running into issues deciding on a topic or finding sources to include, let me know and I'm happy to help. So your annotations should be full citations in MLA, APA, or Chicago format. What you're going to want to do is keep your voice and perspective throughout the annotation. And you're going to want to make sure that the annotations are essentially going over the main ideas that are covered in the article and how those ideas are relevant to your overall topic. So if your topic is communication at childbirth, right? How does this annotation add to your understanding of this issue? So with that in mind, let's go ahead and dive into some of the key ideas here about patient-provider relationships. If we think about patient-provider relations, it's one of the biggest elements of communication because it's between somebody who's seeking out care and somebody who's able to give that care. And that can be a big challenge. A lot of people talk about talking to a doctor and feeling like they're not being listened to or understood. And a lot of doctors like to vent about having difficult conversations with their parents. If you've watched television shows such as Grey's Anatomy or Scrubs, you're familiar with some of the challenges in this communication process. One of the biggest ones is trust. Is my provider somebody I can count on? Are they going to provide quality care? Right? Is this patient somebody who's serious about receiving care and following the instructions that I give them? Clear communication is really important too, between the patient and provider. Are they able to engage closely and respectfully with one another? Understanding expectations is really important too. What is the patient looking for? Are they looking for a prescription? Are they looking for some extra help? Making sure that both parties know what it is that this meeting is about is important. That the provider has expertise, that they have a background that's relevant to deal with the issue. For instance, being a specialist like a rheumatologist. And is there mutual respect? Does the provider respect the patient? Do they listen and make sure that the patient is being heard? And does the patient respect the expertise and background of the provider? These are all challenging factors to developing that effective communication relationship. So patient-provider relations is about looking at interpersonal dynamics, right? Interpersonal communication is referring, of course, to communication between two people in a meaningful way that we oftentimes see play out. We also know that this plays out in some group dynamics too. For example, a health team might be a variety of people that you work with. Perhaps you have a fitness coach, perhaps you have someone that's working with you on cancer treatment, and then you have somebody that's dedicated to your diet and nutrition. So having a group of people working together can also raise some unique elements of patient-provider communication. And then we also know that patient-provider relationships look incredibly different on the basis of things such as power and authority, right? The ability of people from a place of power, privilege, the ability to communicate across differences, including gender, culture, and so on, are important considerations, knowing that the definition of what it means to be healthy and experience health might look very different across some of those boundaries. One of the challenges of power is that oftentimes we assume physicians have the power, right? They are the doctor who's prescribing, they're dictating the appointment, right? And they might talk more. But it's a good idea if you're a provider to give more power to the patient, right? Good communication between patients and providers means that the providers are invested with the patients on decision making, that the patients get to decide certain procedures, what they're doing for their health, and feeling like they're involved equally as partners. In fact, effective providers are typically ones that provide information and resources that allow patients to make their own effective, autonomous decisions. So providers generally try to reduce power whenever possible to make sure that patients are informed, aware, and kept in the loop. In terms of providers, one of the challenges is that physicians are oftentimes in a role where they're directing the process, right? They're asking patients to do certain things, like, you have a splint and you're being asked not to move your arm, you're being asked to apply some type of treatment a certain amount of time a day. That can be a challenge to communicate trust with those directives in place. Sometimes physicians can do blocking. If someone is bringing up an irrelevant topic, or something that's not useful to their health. For example, they're worried about their shoulder. They think it might be dislocated. The symptoms do not indicate that their shoulder is dislocated at all. They might try to block and steer you away from that line of thinking. Sometimes a provider can be patronizing, where they're disrespectful, they're not thoughtful or engaging in the issues the patient is bringing up. A good example, if you've ever watched the TV show House, right? That's an example of poor bedside manner and Gregory House communicating in a way that's oftentimes seen as disrespectful and patronizing. We also know that providers can sometimes engage in transgression, can communicate in a way that's considered to be inappropriate to their relationship. For example, asking about marital or relationship status in a meeting that doesn't really seem relevant to that topic. The point is that neither patients nor caregivers like when the conversation feels lopsided. On the end of the patients, they want to make sure that their voice is being included and understood. And on the point of the providers, they want to make sure they get a word in edgewise to communicate their own concerns and prescribe possibilities for better supporting the patient's health. Another idea that's important here is what's known as the disclosure decision-making model. And this is a way of mapping out how health relationships can occur. Typically, under this model, there is a predicted outcome. In other words, what is it that both parties are seeking out of this? Perhaps your wrist is hurting and you're going to a doctor in order to understand if it's serious and figure out a solution to the problem. There's an anticipated reaction. For example, perhaps the doctor is going to prescribe an ice pack and a medication that you can take, along with some advice about how to manage the symptoms. And the idea of having confidence and skills, both from the provider in terms of effectively diagnosing and understanding the problem, and also from the patient in knowing that they can do the things that they need in order to support their health. We also know that a valuable model here is the use of collaborative health, that patients and providers can be treated as peers rather than treated as a one-sided relationship. That under this model of collaborative interpretation, health communication is where patients are becoming their own decision makers. They're deciding what surgery or treatment or action is best for them. And caregivers are people who help them to achieve the goals, give them the information and the resources that they need in order to make their own decisions. So the idea of an outcomes model is moving away from medicine and instead focusing more on health and fulfillment. What can we do to help you have a meaningful life? And maybe there's some medication or action people can take. In other words, someone is a health citizen rather than a patient. It's about figuring out solutions and working together to solve an outcome or issue. Rather than saying, take this medication, it'll save your life, or you need this surgery, recognizing that perhaps the surgery or medication is fitting in the broader goals that somebody has. They want to get out, they want to walk again, and this medication is the way forward. Patient-centered care is a model that is focused on the well-being of patients, right? We'll, in this week's reading and activity, be looking at some of the ways that we can emphasize this care effectively in health interactions. There's also the idea here of motivational interviewing, right? Using the interviewing process, particularly as a provider, to understand the needs and concerns that people have related to health. Being respectful, letting the person receiving care set the agenda, their interest in the issue, exploring why somebody is ambivalent. Why aren't you interested in this treatment? Oh, they discovered that a relative has had a lot of complications related to a similar surgery. Listening, elicting, right, providing that further information, and so on. Really making sure that you're eliciting and drawing in the support from the patient is important. Being a partner that provides a variety of different options, that isn't convincing you to do one thing, but is giving you the options on the table. Recognizing that patients aren't always going to agree, right? They're going to resist sometimes. And focusing on empowerment, collaboration, and confidence. Letting the patient feel good about the decision that they're making, knowing that it's been informed by your expertise is an important approach that a provider can take. So there are a number of ways that you can use verbal and nonverbal communication too, right? Showing interest, allowing silence, being friendly and supportive, using open-ended questions, being reassuring and supportive. Those are all things that we can consider here. We oftentimes talk about good bedside manner. It involves the use of respect, understanding, and being engaged. We especially know there have been a lot more meetings that have been shifted to online and telehealth, and it can be more challenging in an online setting to figure out if the other person is really paying attention to you or if they've got some other tabs open in the middle of your meeting. So really emphasizing that attentiveness during the meeting is an excellent way to cultivate good communication, showing that you care, showing that you're engaged, and expressing yourself non-verbally, even if it's in a remote meeting, is an important way that you can help support some of the needs that people have. Another key idea here is the use of narrative medicine or storytelling, right? The idea is that in many situations, the stories that we tell ourselves about our health are some of the most powerful ones that we see. Sometimes we have what's known as a sustaining narrative, that perhaps you've dealt with a major sports injury, right? You are needing to use a cast for a while, but you still have good relationships. You're still hanging on and doing well, right? You have an enduring narrative, which talks about the ways in which you've survived an incident with a significant impact. Perhaps you were in a serious car accident and injured yourself, but you survived, you hung on, right? You beat cancer, as you might see in a lot of that type of advertising. A preserving narrative is about retaining the positive elements that are related to an incident or issue, right? So you are preserving the things that matter most in your life. You can still get outside and enjoy the fresh air despite a serious injury. And a fracturing narrative is suggesting that a health issue has significantly altered your communication and ability to engage. When I broke my leg, I was in severe pain and I didn't really feel like I was fully myself anymore. That's a common use of this type of narrative to describe experience. And as a provider, it's important to understand the types of narratives and stories that patients are using, because that's how they determine and make sense of those experiences with their body in the context of their lived experiences. So when you're a patient who's receiving care, generally it's a good idea to come in prepared in advance, right? To have an understanding of the types of issues that you want to talk about, the most important things that you want to talk about in the limited time that you have, to make sure that you have providers who are qualified and able to give the care that are needed, taking an active role, setting the agenda. One thing that we oftentimes forget in these health settings is that providers and patients have limited time together. So really trying to take advantage of that time, not spin in circles or be given information you already have, but instead to focus on the key questions or issues that are outside of what you already know can be a really important element of a good, strong patient-provider relationship. If you're a patient, oftentimes you experience a lot of uncertainty. It can be unsettling and difficult to manage. And the idea of receiving social support can be difficult too. For instance, one issue a lot of patients bring up is that sometimes rather than looking at the patient, the provider is looking at their body. They're looking at parts of the body, and it can feel like they're being analyzed. When I've done on my own health communication research related to disability, I've had a lot of people express in this research that they have felt as if they're a specimen, right? Where they're not truly treated as if they're their own autonomous human being. So really showing the support for the person as a person is really important here. For patients, there can be the voice of life world that is relating to health and illness to everyday experience. Ever since I broke my leg, it's a lot harder for me to get out and walk around. Whereas the voice of medicine is much more concerned about precision, right? About what it is exactly that happened. So maybe there's a hairline fracture here, the T5 is broken, right? So providers tend to be more focused on the data and empirics, and the patients tend to prioritize the feelings and voice of life world more. But emotion and that impact can also impact providers too. Seeing how somebody is being affected at a human level after breaking their leg is an important element for providers to be looking at. Preventative health is a really important element that can be given. As we mentioned last week, countries such as Japan actually spend far less money than the United States on healthcare, but are all very healthy. And preventative care is a big reason why. Discussing prevention, how do we stop or prevent something like cancer, is a lot less emotionally charged. It's a hypothetical, right? It's not impacting the person yet. And somebody feels empowered to take action to address the issue. We're more likely to delay goals than we are to challenge caregivers. So if we're told to do something like cut down on the sweets, right, then we're more likely to, say we will and then not, right? Than we are to say, well, no, I should do it if I want to. And we're more likely to self-advocate and take action if we feel like we can have an impact. So preventative care is great because you say, oh, I know what I can do. I can take action to stop this issue from happening. So patients can practice preventative health in a variety of ways. This can include the use of support and dealing with issues related to stereotypes. For example, sometimes a lot of patients feel as if the caregivers or providers are generally uncaring or detached. They don't really feel invested, right? Care and attentiveness are really important. Patients need to be willing to accept medical uncertainty and be comfortable with asking questions, right? There's no bad question. I don't understand this issue. Can you talk about this? What is this abbreviation? What is this concern? Many patients feel good about care, but they don't like their doctors because they feel like their doctors don't really listen to them or take them seriously. So it's important in a supportive way to provide that type of respect mutually, and that can save lives if it means that the patients are receiving preventative care that they wouldn't otherwise. One of the challenges as well is the issue of patient dignity. If we think about this, right, patients, when they are going in and talking to a doctor, are experiencing a number of invasions of privacy. What history or chart does the doctor have? What do they know already? right? How might we deal with a negative health experience? And how do we deal with people who are in a compromised state? For example, if somebody is in a hospital gown, they're in a bed, they're using an IV, oftentimes people have some pride in being presented in that way. This is not how I wanted to appear to other people. So that can be a challenge in terms of making sure that patients feel respected in the process, and they might be more willing to compensate in their communication if they feel that they're in that type of compromised state. So ARC-PEGS is an acronym that can be used to describe good patient communication. Again, showing attentiveness, showing respect, showing convenience, right, being available and accessible, showing privacy and support for the patient's confidentiality, showing empathy and an understanding of the challenges the patient is going through, a sense of control that's given to the patient, and showing genuine care, right? Oftentimes the providers we stick with are the providers who seem like they really do give a care. And so showing that care as a provider is an important but challenging issue. As we know, not all patients are going to follow the advice that they're given, right? Sometimes the recommendations and support are difficult. Sometimes people don't understand what they're being asked to do. They might disagree. They might feel like it doesn't work or have an impact, or sometimes people feel side effects, like they're supposed to take a medication, but the medication gives them a headache, and so they decide to stop taking the medication. So that can be a challenge in effective relationships too, is recognizing that while somebody might be nodding and agreeing at the time, they might not be following the advice afterwards. You might be familiar with the Tuskegee syphilis study. This was a case in which informed consent was thrown out the window, in which there was essentially the lack of support for African-American test subjects with regard to medication that was supposed to be able to prevent syphilis. But because of a lack of communication, a lack of accountability, and a lack of self-disclosure about what the study was actually addressing, we had people who were dying because they were not being given the actual treatment, and the treatment was withheld and not disclosed in an informed way. So due to some of the many ethical challenges related to this study, there was a significant change in the framework and ethical guidelines. And to this day, we see a lot of issues surrounding trust and belief in the healthcare system that emerged from some of the breaches of health and support that came from this study. This brings us to the idea of informed consent, being aware of the risks, the treatments, the options, and making sure that the patient has the ability to refuse treatment. Informed consent in many ways grew to the way it does now as a result of Tuskegee syphilis, right? Where people were put under an experiment that cost their lives and well-being without being fully told what that experiment was entailing and being about. So informed consent is crucial. We also experience identity as it relates to our experiences of illness and challenge. Pictured here is the late Judy Heumann, who recently passed away, who was a major advocate for disability rights in the United States and helped lead to the passage of the Americans with Disabilities Act, which guarantees reasonable accommodation on the basis of disability. Oftentimes, people move between stages. Perhaps somebody has been diagnosed with a serious condition or illness. Oftentimes, they start with a supernormal identity. You can think about it almost as a denial. Somebody is refusing to let the illness or condition impact them in any meaningful way. Then they move to a restored self that is less optimistic, but still kind of in denial. I recognize that I have this condition. It's going to affect me in a few ways, but it's not going to be a big deal. There is a contingent personal identity where somebody begins to confront the challenges and recognize the scope and degree to which they're being impacted. And then they create a salvage self, which is a transformed identity that's engaging with and fully understanding the limitations that they encounter, right? That is becoming more thoughtful, engaged, and able to understand how their illness is changing their lives. Again, the role of personal narrative and storytelling is crucial to understand the challenges that patients experience. For caregivers, we know that they go through a significant amount of labor and work. The number of years of class, of clinical expertise, of conducting a residency, following med school, it is a very long and exhausting process, and medical fields have seen some of the highest degrees of burnout of all careers, and that was before COVID. So we can probably imagine how much worse that's become, and It's been shared as such among a lot of caregivers and providers. Becoming a caregiver can be an incredibly challenging process. Oddly, right, the process of studying about health can be unhealthy. The process of gaining, memorizing information, becoming socialized in the healthcare field is a challenging one. And the voice of medicine emerges as a way of primarily developing those skills, right? Getting the factual, quantifiable information about health. It can be emotionally isolating. It can involve a lot of scut work, right? Which is kind of like a lot of the very tedious tasks that people have to do in healthcare settings, and the intense emotional response that comes with dealing with somebody dying, somebody not receiving care, dealing with incredibly difficult scenarios. Again, the television show Scrubs is a great example where the main character is having to deal with the unique challenges that come in working in a hospital. So providers deal with organizations, right? The organizational processes, including Grand Rome Hospital here in New Grand, where the organizational processes is how they do something, and organizational culture refers to the beliefs and assumptions they have. So organizations, including hospitals, are shaped both by the formal expectations and cultural expectations that develop over time, the relationships that they have. You ever go to a pediatrician that works with children, right? They use a lot of bright lights, they use a lot of colors, and sensory inclusive environments as a way of conveying a culture that is acceptive and supportive of children. So in terms of creating good relationships with patients as a provider, starting strong with clear information and support, not interrupting or multitasking, feeling, again, like the patient is empowered and able to make their own conclusions about things, and not ending the visit before you ask questions or concerns is important. Caregivers oftentimes have limited amounts of time to address or to deal with issues as well. Caregivers are dealing with intense burnout, right? The emotional exhaustion and challenges that come from the demands of the work that they deal with, a sense of disengagement, especially as a provider is dealing with a series of harrowing and challenging issues, and a reduced sense of accomplishment over time, where over time it feels like they're not really making a dent or making a difference. Caregivers also find themselves faced with a variety of forms of economic pressure and feeling a push to provide care as quickly as possible. Psychological factors like their satisfaction, their maturity can also impact the process. And providers can be put in a situation where they don't see a winning option. Perhaps there are no treatment options that work well for a patient and they have to give bad news. So sometimes caregivers can be detached, not too emotionally invested because of the impact that it can have. Empathic communication model suggests that the burnout that providers experience is because they're continuously trying to provide support and help their patients. And the relational health communication competence model suggests that being competent and able to engage well with patients is supporting emotional resilience. That is, the better a provider is able to build emotional skills and communication skills, the better they're able to manage their boundaries while still maintaining care when they reach out to and provide support to patients. So some things that caregivers can do, doing things like daily debriefs, having the good experiences of being a caregiver be things that are regularly included. Like if you have a treat you bring in for lunch, like do that regularly. Being mindful about your time and how you utilize your time is important, right? As seen here, providers, caregivers generally have a very demanding schedule in terms of the amount of tasks and responsibilities that they take on. About a third of their lives being clinical work. I posted a scenario here you might think about a little bit here with regard to how somebody might manage burnout. You don't have to complete this for attendance, but it's an option for you to consider, right? If somebody has started a new medical residency, how do they deal with being overstretched? What are ways that they could deal with that challenge? Medical mistakes and never events can happen, right? A never event might be that somebody has amputated the wrong leg, which has happened through some of the challenges of miscommunication and issues. And there are some strategies here to talk about and address that issue. Establishing trust, feedback, addressing issues, showing care, putting things into writing, owning up to mistakes, and really taking responsibility for what happened, why it won't happen again, which can be crucial when addressing those major types of issues. And again, burnout and emotional exhaustion and overstretch can make medical mistakes a lot worse. Rehearsing, discussing, dealing with, and providing empathic communication is an important way by which we can respond to and engage constructively when these types of errors and challenges happen. Again, we don't like to think about them. They can be a major issue, but it's good for us to develop a framework for how we can address these problems if they do come up. As mentioned here, right, there are some ways we can explain the harm that happened, ways to address the harm, to prevent future errors, disclosing some of the issues related to errors, and providing resources that will help people in navigating the impact that error has had. Health teams are also a way to support patients from multiple perspectives, right? So we took some time earlier to talk about the importance of health teams from the perspective of patients, but from providers too. It can be a way for people to work together from expertise. Perhaps you have a general care physician, but you also have a rheumatologist who specializes in a lot of forms of autoimmune support. So being able to provide support from a variety of different angles, to be able to provide medical referrals, for instance, is a good way to ensure that the care given is well-rounded. So to wrap up for this week, we covered a lot of ground here, but we talked about some of the challenges that are facing patients in advocating for some of their needs in health, the challenges that are facing providers, including the stressful environments that they find themselves in and the difficult issues they have to reconcile with, and the idea of how strong patient-provider relationships can be developed through trust, genuine care, and investment in one another. Next week, we'll be exploring some of these topics further by looking at issues of culture and race in health and science communication as well. Best of luck in working through your assignments this week. Have a great rest of your week, and I will be posting the video again next Monday.